Facebook friends. This is Dr. Christian Augustin with Bayside Chiropractic and Rehab. And today I wanted to talk about something that is very simple and give you some pointers to help you with it. And that is posture and what causes poor posture. And, you know, both for a health reason and also for an appearance reason. I can see a lot of people and they're always complaining that their posture is poor and they got a low shoulder or they got a high shoulder or their neck sticking out. And sometimes it's appearance that bothers them and sometimes they're actually having pain. So I'm going to give you a few pointers on what you can do at home and then when you should actually seek help. Okay, most posture problems are caused by muscle imbalances from prolonged positions. So in other words, if you stay in a position too long and your muscles aren't balanced, so one's contracting and one isn't, eventually the contracting muscle shortens and you start having a different posture. So let's start with the sitting posture. This would be a good sitting posture. So if you work in an office and you are sitting like this, that's not a good posture. So what you want to do if you work on computers a lot, which are the main cause of the problem, is you want to have your computer screen at eye level. So most of the work you're seeing. So you don't have to look down, look up. If you have a laptop you work with, raise it up. Get a separate keyboard so you can work that way. But always try to have your body up straight, your knees underneath you, and kind of not leaning forward, not leaning back. And that'll prevent those muscles from tightening. Now, one good thing too is to get a desk that elevates and lowers. So that way you're not sitting all day. So you see them on late night TV where you can actually take the whole desk up and then stand for a while and then take it down. So you're always changing your posture, which is good for muscle balance. Now, having said that, some people can't do that. So one thing is to stop and stretch. So every 20 to 40 minutes, just take the time, just a few, not even a minute, and just relax. Don't look at the screen and just do some range of motion exercises. So what you can do is you can roll your head to one shoulder, roll your head to the other shoulder. Stretch this way, stretch that way. Stretch, and then stretch. Just simple things like that to give yourself a little bit of room. Now, one thing to note, if it's just posture, that's fine. And if you see it changing, that's fine. If you start having pain associated with that, you've moved into another category because now joints and actual injury, even its micro trauma, has occurred. So you should be calling, your chiropractor, call my office and do something about it because it's gone beyond where you should be trying to probably be able to fix it on your own. Men in cars, take your wallets out of your back pockets. Don't sit on your wallet. Pretend the car's like your desk. Try to sit up straight. Not like this, not hanging over the steering wheel. Sit looking over the steering wheel straight. And take your wallets out of your back pocket. It pushes your hips up and then causes a problem. Again, if those things are already starting to cause pain, it's time to call somebody. Standing on your feet. Well, try to stand up straight, look straight ahead. If you work long shifts, cashier, on concrete surfaces, big deal. Get good, comfortable shoes. Because if your feet start having problems, your low back will start having problems. So one thing you can do is just get comfortable shoes. Women, that might mean dropping the heels a little bit and not being pushed forward so far for low back problems. There's nice shoes that women, I know women are good with their high heels, but if you're at an inch or 2 inch high heel, you're probably okay. So long you start getting into higher than two, you can have a lot of problems. Okay, when laying down, I've come to the conclusion you can't really change the way people sleep, whether you sleep on your back, your side, or your stomach, which obviously stomach's the worst position. Um, you can't really change that, but what you can do is you can get a pillow that actually supports your head. So if you're a side sleeper, you don't want to have a pillow where you're laying on it and your head's all pushed this way. And you don't want to have a pillow that's all where your head's sunken all down this way. You want to be neutral. Give your shoulder, pull it out from underneath you. Same thing on your back. You want to be neutral, not push forward, not like this. As far as what type of pillow, two things. It has to be supportive and it's got to feel comfortable to you. So it's got to feel nice on the face. What it is doesn't really matter so long it supports you. When watching TV in bed, do not use pillows to get your head like this so you can see the TV. Sit up. Put a pillow behind your back and watch TV. If you start experiencing pain in your low back, especially from a sitting to a standing posture, so if you're sitting and you try to get up and it hurts, if you're sitting and it hurts, if you're doing these exercises I just showed you or the things and you've got pain, please call an office, because what it'll lead to, even though it might only be muscles that cause the posture problems, eventually it leads to degeneration of the joints. And usually pain indicates that you're starting to have degeneration or more severe muscle problems. And you should get checked out. Again, if you have any questions, you can call me. If you're experiencing pain, please call me. And my number again is 251-990-8388. My name is Dr. Christian Augustin at Bayside Chiropractic and Rehab. Thank you.